Okay, hi, my name's Helen. I'm presenting on my master topic, which was Neurological Disorders, with a concentration on Alzheimer's disease. And the reason I decided to choose this topic is because I wanted to discuss the great burden of neurological disorders in recent years, especially Alzheimer's disease. As life expectancies have increased, the rate at which people experience dementia is far higher than that of several years ago. So first, I want to talk about the progression of Alzheimer's in the brain. In the early diagnosis of Alzheimer's, signs and symptoms include memory loss that disrupts ability to perform activities of daily living, challenges in planning, solving problems, difficulty completing familiar tasks, confusion about time or place, and trouble understanding visual images. This mild cognitive impairment stage usually has a duration of about 7 years, and the disease begins in the medial temporal lobe. Common difficulties include problems coming up with the right word or name, troubles remembering names when being introduced to new people, challenges performing tasks in social or work settings, forgetting materials that was just read, losing or misplacing valuable objects, and increasing trouble with organization. Mild Alzheimer's sees the disease spread to the lateral, temporal, and parietal lobes. Symptoms of this stage include reading problems, poor sense of direction, and poor object recognition. This stage usually lasts for about 2 years. So moderate or middle stage Alzheimer's sees the disease spread to the frontal lobe of the brain. Symptoms of this stage include impulsivity, shorter attention span, and poor judgment. You might notice the sufferer with Alzheimer's confusing words, getting frustrated or angry, or acting in unexpected ways, such as refusing to bathe. Damage to nerve cells in the brain can make it difficult to express their thoughts and perform routine tasks. This is the point at which most symptoms will be noticeable to others, when individuals lose the ability to respond to their environment, carry on conversations, and communicating. Pain becomes difficult. Because individuals need round-the-clock assistance with daily activities and personal care, this is when Alzheimer's can be said to rob the individual of their freedom and of their lives. Next, I want to explore some of the risk factors for Alzheimer's disease, of which include age, family history, and genetics. These are all risk factors that we can't change. However, research has revealed clues about other risk factors that we are able to exercise influence over. There is a strong correlation between serious head injuries and future risk of developing Alzheimer's, and we can protect ourselves and our heads by buckling our seatbelts, wearing a helmet when participating in sports, and proofing our homes to avoid falls. Another promising line of research suggests that strategies for overall healthy aging may help the brain remain healthy and may even reduce the risk of developing Alzheimer's later in life. These measures include eating a healthy diet, staying socially active, avoiding excess alcohol and tobacco, and exercising both the body and the mind. Strong evidence due to research has linked brain health to heart health, and Alzheimer's has appeared to be linked to many conditions that damage the heart and blood vessels, including heart disease, diabetes, stroke, and high blood pressure. People who are at risk of these diseases may work with their doctors to monitor their health, heart, and treat any problems that arise. Other non-genetic factors that contribute to risks of Alzheimer's include toxins, viruses, and cognitive ability. So, one of the potential treatment methods I explored in my research report were hormone replacement therapies aimed at helping women to reduce their risk of developing Alzheimer's. Recent studies have indicated that taking estrogen supplements at crucial stages in a woman's life could protect their brains. The risk of developing Alzheimer's is suggested to be reduced by more pregnancy in a woman's life. This suggests that the female sex hormone is linked to dementia because estrogen is highest at puberty and pregnancy, and it is during menopause that the hormone is at its lowest. Some researchers theorize that it is the dramatic transitions of the levels of the hormone that causes problems and not the hormones themselves. Hormone replacement therapy can mediate this issue regardless because it minimizes the drastic changes in estrogen levels during menopause. What this means is that instead of seeing such a drastic fall in the levels of this hormone in a woman's body during menopause, taking hormone replacements will help mediate the hormones that are being lost by the body. Researchers hypothesize that some of the attempts to treat the disorder are only useful years and years before the symptoms of Alzheimer's becomes evident. What this would unfortunately mean is that once the devastating symptoms of delusion, depression, and aggression that Alzheimer's is so well known for are prominent, all attempts to rescue the brain from mental decline may be too little too late. So, one of Alzheimer's most defining known characteristics in the brain is the accumulation of senile plaques at the ends of brain neurons. The beta amyloid is thought to be the primary instigator for Alzheimer's damage to the brain, so it is unsurprisingly the focus of many attempts to cure the disease. So many cures and treatments attempt to find the inhibitors for these secretases. Metal ions like zinc and copper, which aggravate the beta amyloids by preventing them from dissolving, also become much more concentrated in the brain with age. In my report, I also found it valuable to focus on how Alzheimer's impacts caretakers and sufferers of the disease beyond the scientific realm, and I found many studies that were conducted to show the non-medical accounts of living with this illness. Through these reports, I discovered that the psychological cost of caregiving is associated with many harmful health effects on family members and caregivers. Such include higher rates of depression, alcohol abuse, and poor physical health. Alzheimer's robs lives. It steals the independence of both caretaker and sufferer alike, and is as much of a lifestyle inhibitor as it is a neurological disorder. It renders sufferers helpless and inflicts pain and patient testing on caretakers. Alzheimer's, therefore, can be categorized as distinctly non-medical. What this means is that dementia is not the most defining characteristic of a caretaker's difficulties and responsibilities. Observations of the continuity and discontinuity in who the sufferer had been can be the most difficult thing for people to witness. In discussing the impact of Alzheimer's, it's also important to focus on what the future holds for the disease for sufferers and caretakers alike. Although new attempts to cure the disease through drugs do not surface often, research for therapies and life maintenance for Alzheimer's sufferers remains active and continues to progress. There continue to be promising treatments and adjustments underway that target both the neurological elements of the disease and behavioral modifications, which I mentioned in the previous slide include physical exercise and watching your diet. Evidence of how hormonal differences between men and women also affects how doctors will be able to diagnose the disease accurately, which in turn affects the future of treating the disease. The wide range of factors that contribute to Alzheimer's disease makes it difficult for trials to be conducted, but breakthroughs for neuroprotective therapies continue to be promising.